A federal rule change is forcing more than 2,000 covered California deferred action for childhood arrivals or DACA recipients to lose their Affordable Care Act coverage. And time is running out. Good evening and thanks for joining us tonight. I'm Steve Price. CBS 8's Esmeralda Perez joins us in studio to explain why this is happening. Esmeralda.
Well, Steve, their coverage is ending in just a few weeks. Covered California says this change comes from the Centers for Medicare and Medicaid Services, the federal agency that oversees Affordable Care Act marketplaces. They've updated the definition of lawfully present, which, as a result, DACA recipients no longer qualify. Time is ticking as August 31st is the last day DACA recipients enrolled in Covered California will have their Affordable Care Act health insurance. Covered California was created under the Affordable Care Act, a federal law, so it must follow federal rules on who qualifies for coverage and financial help. A new federal regulation now excludes DACA recipients from being eligible.
Unfortunately, that does mean Covered California now has to move forward with disenrolling the 2,300 DACA recipients we cover today from coverage, and then doing everything we can to give them information and support their other options that they may have for health care and coverage.
Jessica points out Covered California is often the place people turn when they have no other coverage options.
That's heartbreaking for us. It's certainly going to be heartbreaking for many of the DACA recipients, and we're going to do everything that we can do again to support people who are in this circumstance, and if there are other options, find them.
At Cal State San Marcos, I met Eric Ramirez, Director of Initiatives and Partnerships for Student Affairs. Eric provides administrative oversight and leadership for the Dreamer Resource Office, a space that offers services and support for everyone on campus regardless of legal status. Eric says CSUSM provides wellness, mental health, and some health services for students covered under student enrollment fees.
We know that health insurance or not having health insurance can cause significant financial barriers and can also cause lack of access to health care that one may need. And so we do hope that for students who may see themselves negatively impacted by this change, that the services that they're able to access here on campus can help bridge some of that.
Eric points out uncertainty is one of the biggest day-to-day challenges for DACA recipients.
Our students or our individuals with DACA have limited protection. You have an ability to work lawfully, but it is not any sort of path to citizenship or anything like that, right? And so I think the uncertainty is one of the main factors, especially for students that are working to achieve their academic dreams and in career goals.
And Jessica tells me letters are going in the mail to people impacted. They will also be calling to offer one-on-one assistance.
So Esmeralda, for people who are part of the DACA program, what can they do at this point?
Well, that's right. So it varies depending on each person's particular situation. Of course, income plays a factor in this. So yeah, there's more to come. They have to, of course, explore their options. But to learn more about this, just visit the online version of this story at cbs8.com.
All right, a lot of unanswered questions at this point. Esmeralda, thank you.